All right. So we took a little breather, and we're back. And again, Hurricane H here, iHealth Radio and the iHealth channel. And this next topic, this next show is, and I'm doing an introduction to different shows. As I stated again, there will be multiples. Each one has a different topic, and I will continue doing this, at least for a minute until we go through all the shows, or at least the contents and the types of shows and series that we will be covering. And then once everybody's familiar with them and we'll have gone through all of them, we'll get started. And then basically, there's no more introduction to the same idea. But that being said, this particular one is Senior Health Series. So this is actually just anything that is related to the senior, market, the senior health, and folks that are actually of a senior age, and what's the health needs, healthcare potential opportunities that they have. And one of the reasons, again, this particular topic is important is that I've done a lot of work in the insurance world with the Medicare, divisions and in the medical space. And what I've noticed is that a lot of seniors that we've come across, that we've helped, get into some sort of a plan or program, they have a lot of confusion about what's available. It's constantly changing out there, and therefore there's just a lot of information that they just have to literally seek. And they attend a lot of events. They attend a lot of seminars, presentations. They get a lot of literally blasted with mailers during certain times of the year. There's so many options that are available to them depending on what they have, their retirement, what kind of work they did, all this stuff. So of course our job as insurance agents, typically we sit down with folks where we do seminars and presentations as to what the basics are, and we go down to break it down to like what's available to them. In the broker world, you actually have multiple plans that you work with, or at least that you have an offering for. And then when you meet with a prospect senior person, you will give them the options, and based on their needs, you'll be able to match the better product for them, the better plan, and ultimately help them out. So today's session is just an introduction to the basics of Medicare. Now, the word Medicare, it's an actual federal program. It's an insurance type of program that people kind of earn over the years based on their contributions to Social Security or through other measures. So if you were working in the railroad, you might qualify. Some people with certain medical conditions may qualify. Some people with disability over a 24-month period can qualify for Medicare. Now, Medicare, for those who may not be familiar with it, is the red, white, blue card, and it's issued at a certain age, or after disability within, over 24 months, you'll get this card. It has Part A, Part B, and we'll talk about that. That's referred to as original Medicare. So those two parts, they have different coverages, and they cover certain components. And so there are actually contributions to this Medicare. So first you have to pay through your Social Security over the years, and then there's a component that goes to it. And if you have enough work history and you qualify for a certain level, and you've met at least 40 quarters of work over the time of your career path and employment, you would qualify for it, and you would not have to pay for one part of it, and then you'll have to have some sort of a premium for the second part of it, and then there's other components. So today I'm just gonna break it down to a very simple level, hopefully. So if you're watching and if you get to see this particular broadcast, this is just to bring you a basic element of what Medicare is. So again, it's a federal funded program. It's kind of like your money funding it in a way, because you work hard for it. It's not just like it's something that the government gives us, but eventually through your Social Security check, you contribute to it. And if you qualify, as I said, 40 quarters or more. Now the reason we say quarters, I remember back in the days they used to tell us 10 years, but it really 40 quarters. So you can work, a year, stop for 2 years, whatever. But over the lifetime, when you qualify at 65, at that point, if you had worked enough, you should qualify for at least what we call as Part A. So again, there are 4 parts to Medicare, and I'll talk about those. But when you get to Part A, you will not have to pay. Now, if you did not work enough quarters or you're short, then you'll have to pay a prorated rate or prorated premium towards the actual coverage until you actually meet the requirement, or you can supplement, more income towards what, and pay towards it. And there's other ways to actually supplement it. If you had some sort of a income level bracket and you meet certain criteria, you might be also qualified for subsidies and things like that. So, but again, there are four parts to Medicare. So the first part is Part A, which is hospitalization. And then Part B, which is your outpatient services, anything that is done outside of a hospital, stay. So your medical doctor and anything that's outside an ambulatory, type of setting, meaning less than 24 hours, within 24 hours, and there is no stay over in the hospital. And then there is the Part D, which is another component, another piece, another part of the ABCs that started, and that actually covers your drugs and your prescriptions. So again, each one of those has a detailed, breakdown to it, and ultimately in different, sessions or different, episodes of the show, of the series, we'll actually, I don't want to do this personally, I mean, I can, but I'd like to invite, different agencies and health plans to facilitate, the breakdown to this and give them an opportunity to share their offerings as well. And not to endorse anybody specific, but the idea is just to share what's available to the consumers, to you, and also for people that are in the profession of health or insurance or, providers. I need to know more a little bit about what these programs and how they work, because oftentimes we had to present also the providers and staff and people that may not be as directly impacted or directly working with the Medicare. Now, the Medicare, when you receive it and you have it and you qualify for it, it's typically, when you turn 65, and literally about 3 months before your birthday, you get a lot of mail, a lot of information gets to you, and you can actually, at that point, discuss other options. Now, with original Medicare, it's Part A and Part B, as we said. Then we had the Part D, which is the actual drugs. So A for, A, hospitalization, inpatient. B is outpatient, ambulatory, less than 24 hours, everything done outside of a hospital setting or skilled nursing facility or home care type. And then Part D, your drugs, your prescriptions. And of course, Medicare does not cover everything. So there is, like I said, there is a premium potential, and even if you have qualified for the Part A and you do not pay premium, there are deductibles. So when you go to the hospital, you have to pay an actual from day one. Once you get hospitalized, there is an actual, deductible you have to pay before, that's out of pocket. There's no matter what you do. All right, there are options to subsidize or to offset that. We'll talk, about those in a different chapter and different, session or different series later on. Then you have the Part D, which is your drugs. And of course, drugs, it's anything that is not necessarily over the counter, but that's prescription drugs that, that you might need, that your doctor prescribed to you outside of a hospitalization setting. So when you go to a doctor writes you a prescription, you need, losartan or any of those statin medicines, for, cholesterol, then you have to go and get yourself, an actual payment for those. So if you don't, if you have Medicare Part D, obviously there is a level of what you have to pay, and we'll talk about that again when we dissect Part D at a later time. I might do it myself or have somebody to talk to you specifically about these parts on a separate note. So that's that. And then there is an actual element that goes with Medicare or original Medicare. So there are two ways you really can do this. You can do it, and just pay, the co-pays and the co-insurance and stuff. Maybe even three ways. The other way is to do it through what we call Med Sub or Medigap policies. So these are set insurance policies that are actually alphabetical, and pretty much they're all over the 50 states and anywhere that's Medicare is alive. So in the Puerto Rico and I guess the U.S. Virgin Islands. So whatever Medicare is actually set, you would have the ability to get yourself, the coverage that you need, and then you'll just have to, get these Medicare policies. You will buy them, you will pay for them in addition, monthly premiums, and then as you pay those dollars to that particular, product, that particular insurance will cover any deductibles and any other costs that you might have, coinsurance or copays. So basically, it subsidizes the cost that you have out of pocket. So again, you have what the Medicare covers. So Part A is hospital, and you have deductibles and sometimes even some sort of coinsurance. And then Part B, which is covering your outpatient at 80% only. So you don't actually get coverage 100%. So you have to actually pay as you go 20%, whatever the fee. So if you go to a doctor, the doctor's visit is $100. You paying $20 out of pocket. The Medicare pays $80 However, if you do have one of those policies that are Medicare policies, you're able to actually pay that premium, and ultimately when you go to your doctor, they will pay. You show your Medicare card, you show your supplemental card, boom. Some of the plans that are familiar, that are out there, AARP, United, and there's other products available in the marketplace. Depending on which state you are, you'll have the ability to actually, look at the listings of the plans, their offerings, and they vary. But the list is pretty much standard. You have all these things. Some plans have different offerings, and maybe they tweak in a little bit the benefit, but it's standardized to a degree. And then the other option, if you really don't want to pay that money, and you don't mind maybe being restricted, because when you have the Part A and B, you can go to anywhere, any provider that takes Medicare, right, nationwide. If you do have Medicaps, if they take Medicare, they take them, right? However, you are not going all over the nation. You're not going every state. Sometimes it's important if you're traveling or if you do a snowbirding type of situation, or you have multiple areas where you visit, frequently within a year, then you might consider these options. But if you're set in your own town, or you don't really travel much and you stay in the same area or service area, if we call it in our business world, what you have to do at that point is you have options. You can select what we call Part C, or Medicare Advantage plan. So a lot of insurance companies, some of them are national, some of them are local, some of them community, sponsored by some provider networks and medical centers. Those actually contract with the Center for Medicare and Medicare Services, and basically that is the regulatory, governmental agency that oversees, Medicare and all the stuff that works with it. And then once they contract based on their service area and they meet certain criteria, they get granted a contract to be able to offer certain products in the marketplace in that particular service area that they apply for. So for example, I'm a plan, I decide to provide care in, a health plan, Medicare product in, let's say, New York City. So I apply for a certain county or certain counties, depends on what, and then you file in. There's a certain strategy for that, there's a certain process. I'll bring you guys back on that, detail when we cover under a different talk show, which is called MCO, which is Managed Care, Organizations World. So that's actually a different topic. So we'll talk about in details how these plans work and how they actually get set, how they contract, how they go through the process, what does it take to actually get a plan together, what does it take to actually build your benefit package, and how you actually ultimately get a list of things that you can, of coverage, services that you'll get if you join that particular plan. So we'll talk about that at a later time. But again, going back to the product, so you join this Medicare Advantage, and so just like we talked about the supplemental piece that covers you the compensation in terms of what that balance, the 20%, or any deductibles or coinsurance or copays, if you choose a Medicare, Advantage plan, or an MA plan, or Part C as we refer to it in the Medicare space, then that plan, depending on the package you pick, may also compensate for that difference in payment. Now, not necessarily guaranteed that you're going to have 100%, because some of these plans have premiums, some of these plans still have copays and coinsurances, but they vary. In terms of what selection you have. You want a freedom to go to multiple doctors, any doctor you want. It's a PPO type, and we'll talk about what that is later on. And then therefore you can actually go to any doctor. So maybe you have a premium and you have maybe lower copays, but you get to go to any doctor you want. As I said earlier, if you choose to stay within your area where you live and you don't really, change much, and you look at the network, so these companies usually have networks if they actually have restrictions. We refer to those as HMOs, health maintenance organizations. And so these companies basically select a network of providers that includes doctors, primary specialty hospitals, pharmacies, laboratories, all the stuff that you need, ancillary services, and then they'll give you a package, and then that network is limited. So if you have a doctor and you have a relationship with your primary care doctor or physician or even a specialist that you actually been going to for years that you want to actually stay with, all you have to do is consult one of the directories of these plans, compare them, see which plans actually your doctors are affiliated with. You can also talk to your doctor and your medical staff, at your doctor's office, and ask them if any particular plan is, the plan that they participate in. Is there any reason you would be one plan or the other? Sometimes providers will actually give you some feedback as to what plan they would prefer you to be with, depending on the medications that are covered and so on and so forth. So those are important facts, that you need to do. So again, we'll talk more about this in multiple shows to come when we deep dive into this and the benefits and so on and so forth. But so HMO, Health Maintenance Organization, that's a very common format of a health plan that is a Part C or Medicare Advantage. And basically, they give you, they take your Part A and B. It's not like they take it away from you, you still have it, but they manage it for you. And then in exchange, they give you all the coverage that you need, in addition to some other things. For example, your Medicare does not really cover dental and vision and hearing. If you choose a Part C, for example, a Medicare Advantage plan, you can get those things. And depending on what package you get, what package you enroll for, then you'll be able to select, what package. So some plans may give you $2,000 for dental comprehensive. Some plans will give you $100 for your regular, just, basic, routine care. Some plans will give you $1,500 for your hearing aids every 2 or 3 years. Some plans may give you $1,000 a year. Some plans may give you $200 for vision care and eyeglasses. Some plans will give you maybe $50. It depends. So whatever the state that you live in, you have to consult what plans are available to you. And when you read about these things, you compare them. So they have what they call summary of benefits. And you look at those. There's also in the CMS website, and we'll talk about those later on. There's some tools where you can actually plan compare, and you can see all these plans and what they the overall cost. What does that mean to you in terms of dollars? How much is going to cost you at the maximum? What is the maximum out of pocket for a particular annual season? So you start in January, by the end of December, what is the most you can pay out of pocket? So those are things that you will be able to actually identify and get educated on, whether directly through a platform through CMS or through the different websites for the different health plans available in your area. Or the best way to do it, and I would recommend this, not because I actually I'm an agent or I run sales division and also have an agency. That's not the case. But it's more about there's one thing to read things and there's another one to have somebody to guide you through it. Now, if you consult with an actual agency or brokerage, they usually have different products, so it's not like they're biased or steer you to one product or the other. But you also can talk directly to agents from a particular plan, and they can give you what their offerings are. So again, if your plan of choice is plan X or plan B or plan A, you maybe call them. You have an actual one-on-one faced interview with one of those representatives or agents. They are licensed, so the requirements to actually be in this Medicare space, you have to actually get an actual state licensure, and so that means you have to go through pre-licensing, and we kind of cover some of that stuff for the Broker World series, and then that will actually talk about more the broker and what the broker is, how they work, how they can go about it, what it means to them in terms of regulations, marketing, so on and so forth, all the stuff, credentialing, you name it. So again, you meet with somebody in person, and you can meet with them at a particular health plan facility. You can meet them at an event, at a seminar. They do seminars across the whole year at various venues. It can be at restaurants, diners, senior centers. Sometimes they do it at different offices and spaces around, with satellite offices from their own locations. But the idea is you can meet with someone, or they can come to your home, sit in front of you with your caregiver or someone that makes a decision with you, and be able to present to you. Of course, they're not supposed to give you any pressure. There's no obligation, but consulting with an agent or broker may help you, or benefit specialist or benefit advisor. Those actually can assist you make the decision. So again, you select a health plan, or you can talk to someone and talk about multiple health plans. You tell them what you need, and as you're talking to someone about your needs, what is important to you? So, for example, if you need dental, you need a plan with better dental. So maybe they have to actually give you a plan that has the best particular dental package. But of course, you have to look at what is that going to cost you. Is it going to be a lot of premium? Is it going to be a lot of co-pays? And all the other benefits that come along. So you look at all that package, you see the options that you have, you like, you move on, you can enroll. Again, no obligation. You don't like the first, particular agent that you meet another person. However, like I said, you can talk to an agent that has multiple products in your area, and they can actually sit down with you and show you all the products. You'll have to have some time to be able to talk to them, and take the time to actually learn what it is. Your health is important. As I always say to people, there are a lot of things that we need in life, and the one thing that we need the most is our health, because without health, nothing else is really valid, right? So we need to be healthy. So it is, important for us to take the time to look at what's in it for us in terms of our health, how it's going to benefit us, because a decision that is wrong can actually have, negative impact on you. You go to a hospital, it's not a network, you have issues, you have bills, it could be a nightmare. So we don't want any of that. So as a benefit consultant is talking to you, they need to be able to guide you to those things and scenarios, and you can ask the right questions. And we will cover what are the right questions to ask at certain time, when you're ready to actually have a presentation. So just to give you as a consumer the guide. And for you guys that are listening or viewing this, if you're not a consumer and you're actually in the industry, you're an agent, you're a salesperson, you're a broker, you have to also understand that you have to be able to do the right thing for our consumers and prospects, so we can help them get the best care that they need in their life. Again, we're talking about a senior market. We're talking about seniors, and so health is very important. A lot of folks at that point may have some illnesses, and anything we do right is going to help them. Anything we do wrong, just because we want to get an application or enrollment in, can impact negatively these folks. So again, just to be clear, you select from a set of health plans, the Part C or Medicare Advantage. You have options. You want an open network, PPO, okay, preferred provider organization. That's actually a separate type of network. It's similar to the HMO, except that it's open territory. You can go to any doctor that pretty much available, and they basically bill them, and they have a payment to them, and that's it. But sometimes those come at a higher cost because you have to pay a monthly premium. So you pay upfront to get that freedom. But again, what I always recommend, why pay money if you have a couple things? If your doctors, specialists, primary, and anyone that you want is actually in their network, and the doctors confirm that. If your prescription drugs are covered with the right copay and it's not expensive, that's something you want to look for. And ultimately, if you have any better value, which means you get extras, right? You get the dental, you get the vision, you get the hearing aids, you get some over-the-counter maybe, transportation, anything supplemental in advance to those basic benefits. It's something you need. Get it. Okay, so that's very important. So again, as a consumer, you look at those. So if you're a senior and you're watching this, if you are a caregiver and you're watching this, the basics are, just to do a quick recap again: Part A, hospitalization, in-hospital, skilled nursing facilities, hospice care, home health, and there's also some blood work that gets covered with that. So that's Part A. There's a deductible to it. You can earn. You don't have to have a premium if you actually earned over the years, 40 quarters and beyond. If you were short, you have to pay extra premiums, once you actually get it, and so on and so forth. Now, Part B, as I said, outpatient. There is an 80% coverage through Medicare. It only covers the outpatient service at 80%. 20% is out of pocket. That is your co-insurance. And if you have options, and you do have options to actually offset that by joining, like I said, buying a policy, a Medigap or MedSup policy to compensate the cost, or you can simply, select a plan in your area that actually offers, an actual comprehensive package. A lot of those plans actually do cover not only the medical part, but also the drugs. So we refer to them as MAPD. So Medicare kind of like Advantage with Part D. So you have those, and then you have some plans that only covers the MA part, which is just the medical. And there are also plans that have some products that are only for Part Part D that you add to your A and B on a separate. So you have an A and B, and you add a Part D. So if you have original Medicare and you don't want to buy anything else, and you just want the drugs to be covered, and you are willing to pay the actual co-insurance, that's an option that you have to. So there's so many options. And as we do these sessions, we'll break down these options one by one, what's covered, what's not covered, how it works, and how you can save money. And we'll give you some tools as to like what is your best option, how you can go out there, and we're not going to endorse any plans, so that let's be clear. I'm not going to be, pushing one plan to you versus the other. We're talking in general. So all the plans are good. All the plans have ups and downs. They have different packages. There is a plan for everyone. There is everyone for every plan. So all you have to do is, do your due diligence, educate yourselves as a consumer. If you are a professional in the space of Medicare and you're actually helping individuals with their Medicare needs and coverages, make sure you do the right thing by them and help them get the best package, the best plan for them. And if it means it's a Part D, great. If it means it's an MAPD, great. If it's a PPO, that's great. If it's an HMO, that's great. There's other groups or other types of segments that may be options like an MSA or Medicare Savings Account. There's also like PFFS or Preferred Fee for Service. These are, alternative options, under the insurance world or the helpline world, but they're less attractive or less popular. So, but the most popular ones are HMOs, Health Maintenance Organizations, or the actual PPO options. And again, like I said, premium, deductible, coinsurance, copays. You got to look at those additional, benefits. Supplemental benefits, those are things you want to look into. So again, if you have Medicare, you have Part A and Part B, and ultimately Part D you have to select, right? And you have a choice with those three to either combine them, have an umbrella under an actual MA plan or Part C as we refer to, or you can have, keep them and just buy some policy to, offset the cost that you might have, when you go for these services. So that's that. So that's really the basic of Medicare, A, B, C, D, basically. So A, again, hospitalization. B, part, outpatient, medical. And then C will be your Medicare Advantage plans. And then D is your Part D. So A, B, C, D. And like I said, you have options. You can look at the ones that you're going to be, comfortable with, and see exactly what is interesting to you, what will work for you. There is, like I said, a package for everyone. All you have to do is do your diligence, and agents are available all over the nation. I mean, there are brokers everywhere. All the companies pretty much have some sort of a team available. Some of them are also on telephone, so you can have a call center type of interaction with the helpline. You call, and an agent that is licensed can get on the phone with you and explain to you. They're courteous. They go through the whole thing. They're scripted. They're regulated. It's recorded. They cannot mess with you and give you the wrong information. You also need to know that CMS is very, 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 very heavy on the health plans, and they actually really scrutinize everything. So any plan that is contracted with the government, with the Centers for Medicare and Medicaid Services, they actually have to go through a lot of process. And like I said, you can watch one of the series about MCO World, what is a health plan, a managed care organization, how does it work, how they contract, all that good stuff. How it was, how's managed care conceived and so on and so forth, the historicals and all that. We'll talk about that. But understand something, everything is regulated, the plans are scrutinized, they have to meet so many criteria. All the plans now have a star system, so basically they have to actually meet certain criteria, and every year they have to get pretty much a credential level. And if you meet a certain point system, just like hotels and restaurants, you get a star. And depending on how many stars you get, a lot more action. And for you as a consumer, the plan with the better stars obviously has a better offering for you, so they can have better customer satisfaction, they have better network, and so on and so forth. But the measures that are used for stars are a lot, and we can cover them at a different, session. But what you need to know is that they have, a lot of oversight. And the oversight is important to make sure that you as a consumer, you are not getting, shortcut, right? You're getting everything that you deserve, that you worked hard for. It is, after all, your insurance, your Medicare, and they manage it for you. So therefore, they have to give you the best. And you are not locked into any plan. Although there are seasons, within a year where you can enroll in those plans or not enroll in the plans. We will cover that at a later topic or later show rather. But we'll talk about those seasons separately. What are the different seasons and when you can enroll, when you cannot enroll, and so on and so forth. Now, what I want to add is that so we're talking about Medicare, but there is another government program that actually sometimes works with Medicare, and that is Medicaid. So it's usually that's run by the state. Your local state has a Medicaid program. And of course, you hear in the politics, you hear in the news, Medicaid, Medicare, all the stuff going on. And so these are very confusing times, a lot of changes are happening. But Medicaid run by the state, Medicare by feds, and it's regulated. And so the Medicaid plans, if you qualify for a Medicaid plan and you already have Medicare, so that qualifies that particular individual as a consumer, what we call or refer to as a dual person. They have Medicare and Medicaid qualified. So if they have both, they can actually get a little bit more than the average person that has only Medicare or has to pay out, out-of-pocket costs and so on and so forth. So you can do that. Another thing, that can help, something to step back a minute, is that if you have a Medicare Advantage plan or Part C, you cannot combine that with the actual MedSup and Medigap policies that I mentioned earlier. So if you it's one or the other, if you choose a Medigap policy or MedSup, you cannot have a Medicare Advantage. So just I wanted to get that and again, we'll cover this many shows to come, and we'll get into deep dive and we'll break it down further. But as a general rule, just a general introduction and overview of Medicare and Medicare plans and options, that's what it is. And then, like I said, so if you have Medicaid, Medicaid gives you a whole set of benefits and also pays a lot of your deductible and the cost. So typically a Medicaid and Medicare, dual have very, very, very little payout of their pocket. There's very little cost. Now, one thing for sure, it doesn't matter what plan you have, you still have to pay your Part B premium. As I said, Part A premium is pretty much paid once you work over 40 quarters. However, Part B doesn't matter. If you actually have worked or not, if you qualify for it, you're going to have to pay for the Part B regardless. So you still have to pay a monthly, and it's deducted from your Social Security. So if someone has Medicare, if your parents have Medicare, someone that needs assistance, they need to understand they will have to maintain paying Part B. There are plans, there are options, there are things based on income and resources and things like that, that a person can qualify for, and therefore they get subsidized. There's also subsidy levels we refer to as extra help for Part D, for prescription and so on and so forth. We'll break those down at a later time. But note that if you have Part B, there is a premium that you will continue paying. Now also, if you do not, when you become eligible, you have a limited time frame to actually select, to either opt in or opt out of certain things. And if you don't pay, not sure what happened, but if you don't pay your premium, you may not have the coverage. Or also you might have an actual penalty that is with you for a long term. So we will cover all those things at a later time. So that being said, I just want to actually wrap up the actual session today and this particular show, and we will resume this at a later time with additional details on dissecting the Part A, what's covered, and then we'll have a different one again for Part B and so on and so forth, and all the different things. And then we'll get into like seasons, when you can enroll, how you can enroll, and then how to combine it. And then we'll talk about different plans and what they offer in details and how you can play with it. And we'll have some guests over to present their offerings, hopefully. And that should be all the good stuff to help you and assist you with your Medicare needs. And that will wrap up today's session. I know it's getting late now, and you might not want to be listening to me live. But again, you can review this as it's recorded, and it will be posted to the YouTube feed. And but that's about it. So Hurricane H here. Hope this was educational. Shed light on a lot of the information. Hopefully it helps you, understand a little bit of the basics of Medicare. There's a lot more. I mean, I've done this for many, many years, and it's still confusing, and you still have to always review it and make sure that you understand it. There's a lot of changes that happen. So again, that being said, this is the iHealth channel and iHealth Radio. Hurricane H. Thank you very much for watching. You like what you hear, please subscribe to our channel for a lot more information and a lot more good shows and informational content. And again, comments, suggestions, please feel free to send us some of your feedback and some of your suggestions. Any questions you have, we can actually answer them to you and do some homework for you. All right. Thank you very much. Have a great night.